Welcome to the Enlightened Life podcast with Alexandra Cousens. Together we'll demystify disease and the debates around health, empowering you toward real regeneration and a life of vibrant vitality.
So welcome everyone. We are here with Jessica Drummond at the Enlightened Life studio. I'm your host, Alexandra Cousens. And I'm super delighted to have Jessica Drummond here with us. Jessica is an integrative health practitioner. Maybe Jessica, you want to talk a little bit more about, all your accolades. We know that Jessica has been working with sort of specializing in endometriosis, treating endometriosis for many, many years, and is really an expert in that. Jessica is also a graduate from our academy and just overall an amazing human being who is helping many, many people with her deeply integrative approach, which I so appreciate. Welcome to the podcast, Jessica.
Thanks so much for having me, Alex. It's my pleasure to be here.
So yes, please toot your horn a little bit, because I feel like you can and you should. And, as always, I love having conversations with people who are deeply open-minded, because I really feel that in this day and age, we have to be. And so what I appreciate about you and your approach is that you are very open-minded and at the same time deeply really integrative in your approach. So maybe tell us a little bit about you and please toot your horn. That's kind of like my new my new motto. We need to toot horns.
Sure, absolutely. So, I was initially steeped in very sort of traditional, conventional education. I got my bachelor's degree here at the University of Virginia in biology, and then my master's was done in Atlanta at Emory University, and that was in physical therapy. And then I practiced physical therapy starting fairly early, like 1999. Focusing initially, so I grew up as a very athletic kid. I was a competitive gymnast from basically ages 7 to 17. And I just always had that athlete driven first daughter mindset, And what happened though was when I got out into practice, focusing primarily on orthopedics, I began to work with some specific women's health cases. So women, for example, with shoulder issues related to breast cancer surgery, or women with back and spine issues related to pregnancy or postpartum. Mm-hmm. And so pretty quickly, I specialized my practice in women's and pelvic health. But what happened was at that time in the early 2000s, we did not have very good tools for supporting chronic pelvic pain. Now, we had physical therapy, which was a great start and is still really valuable, but the surgical techniques were not very advanced, and at least the ones that were in practice where I was. And many of my patients were, there was a big focus at the time. We now have all the documentaries about opioids, but working in hospitals in that time, the big focus was on pain management. And we now know that was driven by pain medication opioid producers. And so many of my patients were addicted to opioids. They had, electric stimulators or implanted into their spines, which didn't work very well. And they just were not getting better. And then I had a bit of an epiphany, because after the birth of my first daughter, I had probably, a post-viral syndrome, if you will, or a reactivation. I had mono twice the year that my senior year of high school. And, my doctor was like, oh, you can never get this again. Like, you'll be fine. We know a lot more about EBV now. That's one of the reasons I stopped doing gymnastics. And then when my first daughter was born, I was just vaguely sick for a long time. And everyone was just like, oh, it's postpartum, you're supposed to be tired. It's normal to get a sinus infection every couple of months. Like, it was just a little bit of a downward spiral for me. And it was challenging. I mean, what they were saying made sense to me because I had a new baby, and my first one. She barely ever slept, at least from my perspective. And so, but I noticed, so eventually I began to really focus on my own health, which was hard to do in a system of taking care of other people. Like, even when I was working on a lung transplant floor, it was like, you've got to come to work even if you're sick, which makes zero sense for me or the patients.
Wow.
But we now know that, I mean, of course I knew it then, but not as deeply as I know it now, that medicine is entirely profit driven. And so, at least, well, most medicine. And so it was a challenging time, but it taught me. So I then transitioned to learn a lot about integrative and functional medicine, because I finally moved back to a place I had lived before, just because I needed to take some time off of work. And I had lived there when I was initially working at this large women's hospital. And all the cases that we couldn't figure out, like, we're at the time we were kind of like, oh, is this exaggerated? Is this person just not really following our recommendations? But if there were sort of quote unquote difficult to treat clients, we sent them to a woman named Dr. Nellie Gross, who was a wonderful integrative and Chinese medicine. She was an MD. She was an early functional medicine practitioner, and she had a lot of skill and training in Chinese medicine. And she worked with her son, who was an acupuncturist. And her office was like a 2-minute walk from my house, thank God, because I spent about a year there. And that was when I really began to understand that hormonal health and immune health and nervous system health were intricately connected and could be influenced by things like nutrition and lifestyle and, stress modification and things like that. And then I thought, well, so my clients with these deep chronic pain issues that usually had to do with menstrual pain, there was some connection with hormonal factors. They varied from client to client, but I thought, I could probably apply a lot of this to them. And I did. And it was very successful. And then I went back to school and got a doctorate in clinical nutrition. And so from there, I've also in the midst of it learned and was board certified in health coaching, which is really a suite of communication tools to help people not just kind of be given a list of recommendations, but to help them really integrate those recommendations into their challenging and overworked lives in most cases.
Right. Because as we know, health issues, yes, they're physical, but they're so intimately linked to emotional, psychospiritual, lineage stuff that's been going on, right? It kind of like really all interplays. And I feel that is where still, I mean, sometimes I kind of think, haven't we talked about this ad nauseum, right? And then I realize you have, or within like our little circle we have, but actually out there, it's still, sometimes it really strikes me at like that's still a novel concept,
Yeah. Yeah. And, even with, my practice primarily is now is I work with women with endometriosis, other chronic health conditions, and primarily those who are in the perimenopausal to menopause transition years, although I certainly work with younger women with endometriosis. But in my practice, I'm very aware that very few people talk about health in such an integrative way. And, certainly those who are still practicing in this within the conventional system, many of them want to practice in an integrative way, because often they'll have experiences like mine where they've had kind of their own health journeys and they realize that the tools we have are not enough, and they're also potentially harmful in the way that they're delivered. But they don't really know what to do about that. So, at least within the United States, Europe, Canada, most of where my professional students are, because I teach a lot of students as well, there's not an easy way to step out of the conventional health system. And the convention and all health practitioners, but particularly those who just kind of come up a conventional route, are very often burdened with a lot of debt, or they're in situations where, they're not being paid very well. And so to step outside of the system, you also have to learn an entirely new suite of skills. So we actually have created a really deep and broad membership program for our community, because we started realizing the necessity of teaching everyone business skills and application skills, because you also have to work with people differently. So every time I've worked in a hospital system or a private practice that was owned by a large organization, especially in women's and pelvic health, we are inundated with patients. In fact, I considered working at a local clinic. I'd recently moved states, and I thought, maybe I could just kind of tap into the community and just go work there and meet some people. And it would be a wonderful job. However, it would be a very heavy job in the sense that I would be expected to see probably 7 to 8 patients a day, which is not very many in the scheme of what you're normally expected to see. It was set up reasonably well. But even then, that is a lot for the type of space we have to hold as truly integrative professionals. It's not healthy for the practitioner to work in that, I would say, that level, that volume of managing people's, as you said, not just their, acute physical pain, but why that is there, the stressors they're carrying, the financial burdens, the family struggles, the relationship challenges, the, just not even being connected to their hopes and dreams. Like, there are so many layers of this that I thought, two things: that is a heavy load for any practitioner to be asked to carry, 40 patients a week, even 30. And that in that clinic, there was a year-long waiting list to see a practitioner. So any of my colleagues who are working in conventional systems are highly overwhelmed with the numbers of people. Then when you step outside of that system, the financial incentives and challenges change a lot, and none of that is taught in our traditional training. So to begin to set up a successful integrative practice, it's I've certainly done it now. I've been doing this for more than 15 years, but almost 20 years now. But it requires a complete new set of skills that most practitioners have not learned. So even if they know they have some understanding that we need a more integrative approach, they don't know how to execute that, because it's not possible to do it within the conventional system fully.
That is such a good point. That is such a good point, because recently I've been kind of like raking my brain and going, we are really facing this huge problem, and it is worldwide, because it's not just the US, it's worldwide.
Yeah.
And where we need people to have this really holistic, integrative understanding and wisdom. And when I say holistic, I no longer mean, as I used to in the past, mean just sort of holistic medicine. But to me, holistic means we need to understand traditional holistic medicine, and we also need to understand regenerative medicine. We need to understand functional medicine. We need to understand what is the latest sort of cutting edge science. What is the place for all of it, right? Because you and I both know there is a place for all of it, but then
Yeah.
it needs integrated wisdom in terms of how, when do we apply one or the other.
Yeah.
And that's a lot, right? Because now we're like, it's no longer enough to be a traditional functional or a traditional Chinese medicine practitioner or a functional practitioner or a no, we need to be all the things in an ideal world. And then on top of it, we also need to be kind of, well versed in the psycho-spiritual handling. And so I was really reflecting on this. Wow, it's gotten so complex. And, of course, we're not going to resolve the issue in this conversation, but that really we need a whole new model, right? To deal with the complexity. And yeah, I don't have an answer yet, but I'm kind of, even just for the listeners to go, yeah, do you realize that when you see someone who is not your regular doctor, who only spends the 10, 15, maybe 20 minutes with you, but who actually has an integrative approach, perspective, and wisdom, those are the kind of people, they're going to spend hours on your case, right? I
Yeah.
mean, we
Oh,
we
for
look
sure.
at, we look at the cases before, we truly take in their whole, not just life story, but being and all the things. And then, I'm sure I do that. And so you must do the same thing as well because of your wisdom approach. And then we ruminate on these people, like we meditate on them for like days on end, right?
For sure. And I think the challenge is that, so two things I think could be helpful to this. One is, as often as possible, I'm working in sort of a collaborative model, taking pieces from colleagues, not necessarily formally, but in a sort of loose collaborative model. So many of my clients are also seeing pelvic rehab professionals. They may also be seeing acupuncturists. They may also be seeing surgeons. They may, for my perimenopausal and menopausal clients, we have a nurse practitioner on our team, and we use peptides and, medical hormone therapy when necessary. So you can work collaboratively. And I think the important thing is to center. So one of the things health coaches do very well, and that's why I always lead with a health coaching approach, is that health coaches teach the client how to be centered in the experience. So ultimately, it's not so much me organizing their team, although there is some of that, but as we move to a more ideal model, the client learns how to take, excuse me, real ownership for her health.
Yeah.
And so when she does that, she then is sort of the orchestra conductor of the other. She can start to take pieces of wisdom, but that takes a huge, some initial work of me with them to teach them what this all means, what some of these other tools, how some of these other tools could be helpful. And then our clients have to be empowered with the confidence to be able to do that.
Yeah.
Because it's not easy when let's say one of my clients is a lawyer or something. She knows nothing about, she might have took one biology class in college, right? And so she's not steeped in the world that you and I are steeped in. She has no understanding, hasn't been introduced to the idea that her place in the family as being a driven first daughter could be part of why she's sick.
Yeah.
Physically. That's a really foreign concept. So we have to help put these things in context for people. And that's why the other thing I think is really important is when I work with people, it's for a minimum of 3 to 6 months, but it's very often 2 to 3 years, and then periodically, thereafter, because we have to help people develop relationships in their lives and make changes about their work and how they're spending their time. And sometimes they have to move, and sometimes they have to gain or lose relationships, and really optimizing health at a very deep level takes time. That doesn't happen overnight. And so I don't think there's a really simple way to systematize that, if that makes sense. But we have to be willing as individuals, and I've certainly personally done that. If health is a priority, we have to invest in it in the same way that we would invest in financial wisdom or choosing a school to educate ourselves, or, it's almost like we have to think of health differently. In most countries, and even in the United States, although we have a terrible healthcare system from a financial standpoint, in most countries, and I think this is a bit of a values conflict for many of us who are in healthcare. In socialized medicine countries, sort of healthcare is seen as a human right, and so everyone has a certain level of access. In the United States, it's not really like that at all, although at some level, everyone has access to an emergency room for things like that. But if we're talking about really deeply optimizing health, people have to learn health, if you will. Think of health as a skill set, not something that's to be done to them, right? And of course, there are acute exceptions. Someone has an acute issue, a car accident, a cardiovascular event, an acute infection, like something that a little bit came out of nowhere, if that makes sense. And that happens for sure. Then the health system needs to kind of save their lives. But even then, like, let's say someone finishes cancer treatment or is discharged from the rehab hospital after their spine injury or their hip fracture or whatever, there isn't a system of then really recovering their health. It's like, look, you can walk, you can work. Like, if you can work, you're good.
Yeah.
You're back in the, capitalist system. And so I think if we're going to stay in this individualized capitalist system, individually, we have to make a decision to invest in our health the same way, and the skill set of health in the same way we would invest in a university education, for example.
Or I'm thinking, sorry to interrupt you, but I'm kind of thinking so much investment goes into beauty products, into fashion, right? Like, it's crazy. And there's always money for that.
Yes.
But then when it's to health, it's like, really? It's wild, but that is the case for many. And yes, this rethinking, my whole argument with so many is, if we were to take our health niggles seriously, we would not get to health crisis,
very rarely. For sure.
Right. But because a lot of things, they just go, oh, well, it's just a bit of this, it's just a bit of PMS. Oh, my PMS is really bad. It's been bad for like 20 years. And you never, and you get migraines and all of the sort of like what we consider health niggles, which actually are major warning bells already. So, just wanted to throw that in there, that yes, there's always money for a lot of things. And typically people don't realize, well, the money should be going, invest in your health properly. And ideally, of course, in prevention.
Well, and I think that's the other side of the coin. So there's certainly a level of investment for health optimization, or for people who have pretty severe chronic issues, which is a lot of what I deal with: chronic migraines, post-viral syndromes, endometriosis, autoimmune disease. That's going to take a lot more kind of cleanup, unlayering, cellular health optimization. It takes more work. But the other side of the coin is that, unfortunately, we are living in a very toxic environment. And so where larger systems like governments and, corporate health, if you will, I wish we could change the conversation so that the investment of their, instead of building more hospitals, it's about changing to access to organic and unprocessed food for everyone, access to walking trails. I live near a park with a large 20-mile walking trail. That will do more for public health than almost anything.
Yeah.
The basic foundational things people are not doing because they're spending a lot of time on their devices, and it's tricky because technology is a double-edged sword. It allows you and I, access to even each other, never mind everyone else we might be talking to today. But we are really, as humans, very separated from those super basic foundations of health: sleep,
Completely.
hydration, walking, going outside at all, having a little fun, eating unprocessed, food that's not full of chemicals, wearing clothes that aren't plastic, like super basic things. If we did that, the need for the complexity that we now have to integrate as professionals would drop significantly. And
100%.
my colleagues in integrative and naturopathic medicine, have been saying this for 30 years now. Like, it used to be that in the beginning of my practice, if I had somebody with a chronic pain condition, we would do a few basic things: change their nutrition, help them do some mindfulness practice, do the manual therapies that we do in physical therapy, change how they exercise a little bit. And most of the time they would get better. But my practice began in the very, very early days of cell phones. And now that their jobs are 24/7, that their stressors are 24/7, like, it is much harder. And like I said, their environmental toxic load is so heavy with environmental chemicals. We now know that there's a 50% increase in the amount of plastic in human brains, and the time frame is pretty short for that.
It's scary. It
It's
is.
a lot to overcome.
Yeah.
We have not only do we have new pathogens and viruses and things like that, but we also have pathogens that have been around, but only maybe in subtropical regions, moving into newer regions because of climate change. So, the exponential heaviness is something that I think we need to combat in two different ways. One is just really being advocates for a cleaner environment and putting our resources in that direction. And then second, as health and wellness practitioners and as people who need, we can't really separate health and wellness practitioners from patients, if you will. We're the same people.
Yeah.
And then people who also need help but aren't health and wellness practitioners. We need to think of more complex healthcare interventions as being, as you said, something that people purchase, invest in the same way that they would invest in other things that they value. Because the current system, there are some things that it does well in terms of just generally keeping people moving, but keeping people healthy, it does not do well at all.
No, absolutely. Yeah, it's a big wake up call, I think, for many, many, many. And, as much as for you and I and the many like us, it seems like redundant. And it's like, haven't we spoken about this? It's like, yeah, for many, this is still a very novel concept that is trickling into their consciousness more and more.
Yeah.
So I feel it's important really to talk about it more and more so that really people can kind of get it and go, well, we're simply dealing with unprecedented levels of stressors, and these stressors are environmental and psychological and just all, it's really all the things. Because when we talk stressors, I think a lot of people also have this idea, oh, but I'm not stressed, right? Like, it's like, well, hang on, stress is probably all the things that you think are not happening that you have just kind of normalized and accepted. So
Yeah.
that's a big one.
And you and I have talked about in the past, I've been lucky in that I grew up with many older women who lived well into their 80s and 90s, nearly 100. And, none of whom used medical hormone therapy. In fact, my grandmother, who died recently at 97, she was on one medication her entire life, total. Like, she took some blood pressure medication. Maybe she took a little bit of additional medication in the last 2 years of her life, but very, very simple in terms of the foods that she ate. She didn't know how to drive until she was in her 40s. So she walked, and, all of their food at the time was from local farms. She wasn't a huge cook, but she could cook from a basic level. Was very connected to her family. She had hobbies that kept her interested till the end of her life, really. She had a very active, connected life and until her last maybe 2 years. And even then, she was cared for by her family. She lived in like a garage apartment in my aunt and uncle's house. And my other grandmother lived into her late 80s. And then she basically died because she got in a car accident. She was driving herself, which probably should have stopped a little earlier. But that's challenging, kind of that conversation about independence. But I think, but what they had for their childhood, their adolescence, even their entire fertile years, essentially, was walking and access to unprocessed food with much less chemicals. I mean, glyphosate didn't even exist until the 90s. So now, in the US, we have double the glyphosate, even that people in Europe have in their bodies, because certain European countries, don't allow it. And so I think, again, if we look at the basics, of course, women in my generation, I just turned 50, need a lot more supplemental support, and whether it's regenerative medicine or integrative medicine, to navigate menopause, because we've lived physiologically stressful lives and often emotionally stressful lives. But as you said, we're sort of like, I can handle it, right? Our entire lives. Think about the processed food of the 70s, 80s, and 90s, less and less and less physical activity. And we were luckier than the generation behind my kids. Most of their generation got a phone in their hand when they were 12, maybe younger. I've been lucky with my personal kids. We've sort of prioritized living in places that were walkable and a lot of outdoorsiness. But that is something, again, you have to deliberately do versus, my childhood, my mom's childhood, my grandmother's childhood. People were just like, go outside, and that's what kids did. So it's an increasingly disconnected and not nourished environment. So, whereas my generation is having a lot of challenges pop up in the perimenopause to menopause transition, a lot of our kids are having challenges popping up when they're children or young teenagers or just at puberty, or, we have increasing challenges for pregnant women. And those kinds of issues our grandmothers didn't really have to deal with until they were in their, 70s and above.
Yeah, so true, so true. Yeah, the hormonal disruption and all of that. And instead of You know, and of course, as you know, my pet peeve at the moment is that every woman who is in, you know, their mid 30s is basically prescribed hormones. Like, there's not even a question. And I'm not anti hormones, I am anti just nilly willy without even looking what's happening upstream, right? Like,
Yeah.
why is there so much? I mean, the fact that we are normalizing being on hormones in our 30s, like
Yeah.
completely normal, is like, can we like actually think about that for a second? You
Yeah.
know?
Well, and we're normalizing, GLP-1 peptides, which are great. They're a valuable tool, but does absolutely everyone need them at the highest possible dose in their 20s forever, or when they're 10 forever? Probably
100%.
not. And this is why we have to be having nuanced conversations. And this is why the sort of profit drivenness of all of this becomes important. So, one of the things that you and I do is we have much more personalized practices where we
Yeah.
do a lot of work with our clients. We teach them a lot of things. We pull in other integrative practitioners to the team, or people that have certain specialized skills. However, that is a lot of work for, the financial reward, if you will.
Absolutely.
What's much easier is to set up a quote unquote weight loss clinic or a quote unquote hormone clinic and just have people fill out an AI driven questionnaire
Yeah.
and then dispense them through, practitioners who have sort of minimal training, but the right license to give them hormones or give them other medications, and all through kind of an AI driven system.
Mm-hmm.
Now, that is highly profitable, and that's where all the private equity money is going right now. Like in the United States, for sure, you can go online, fill out a short questionnaire, and be prescribed hormone medications, erectile dysfunction medications,
That is wild.
weight loss medications, whatever. You can go to a clinic that maybe has a nurse or a nurse practitioner, a PA, or a physician, but they're just kind of working via telehealth, and they're not really doing anything. They're not
Yeah.
stopping for a moment and saying, okay, here's why you probably would benefit from this medication. And it will work a lot better if we do X, Y, and Z. And, or this medication may benefit you, but could we wait 5 years and set some foundations? Could we wait 6 months and set some foundations for your general health? And then you may not need the medication, and it also kind of leaves in the dark people who try that route and it doesn't help them, or people for whom it's contraindicated. Sometimes these medications, people should absolutely not take them for various reasons. And it's just like, oh, well, you don't fit the questionnaire. So you're like, you're out of luck, whatever, go back to doing what you were doing. And so that's the thing that really frustrates me right now. I think we have to break through the conversation. That's why these conversations are so important, because that is not the answer. That is the most profitable answer.
Mm-hmm.
That is the simplest answer, but it's not going to set people up for, especially if we're talking about the menopause transition, 30, 40, 50 years of health. It's going to,
No, what
at
we're
minimum, patch
doing,
symptoms. Yeah. Yeah.
to me, what we're doing is I say currently pharma is seeing women, big pharma is seeing women as the new cash cows, right? Especially
Yeah.
middle-aged women. We are the new cash cows of big pharma, because guaranteed, you start taking hormones in your mid 30s, you're not going to fare well for very long.
Yeah.
Unless there is an integrative approach. And similarly, I mean, how deeply I love peptides.
Yeah.
In fact, I was telling my husband jokingly, like, I should write a book, my love affair with peptides. Like, I love peptides,
Yeah.
but it's one of those things, like fasting, like so many things, done wrongly, the wrong dosage, without comprehensive protocols, and you have an absolute recipe for disaster that then actually only gives a bad name to something that can be so incredibly helpful, right? Because that's kind of what we're seeing now. There's all this demonization about peptides, and, I mean, there's demonization, there's celebration, and the truth is always it's somewhere in the middle. And as amazing as all of these tools are, they are completely worthless without the holistic, comprehensive protocols
And the
approaching.
conversation. Yeah, the conversation. Like, what is this going to do for you in your life? And even if a person's on it for 30 years, it's a matter of them really understanding why and what else they can do, because it's not really a perfect solution. It's not a perfect solution in a vacuum. And it's not just big pharma. We have these conversations about like large pharmaceutical companies. It's also tech, private equity, app developers, people who want to, and look, I would love to do this if I thought it would work. But if you're a real integrative clinician, you know that this strategy is never going to work. It's going to help people feel better temporarily, but it's not going to give them what they need, because what it basically does is quiet the niggles that you were talking about, right? Early and often, a little bit, not even that well. And it quiets the niggles without being like, okay, here's why this is happening. Here is the suite of tools for you to change this. This is mind, body, it's emotional, it's relational, and you have the opportunity now to listen to that yellow light warning signal, if you will, on your physical vehicle and take a suite of actions. Or you can just sort of quiet the symptoms. And sometimes doing both is really the best strategy, because we do want to use all of these tools that we do have. And we need them, quite frankly, because our environment is so different that we might not have needed them 50 years ago. I think we need them now. But how we deliver them is really important. And it's not getting that message, I don't think, is getting out nearly enough.
It's not. And my other pet peeve, as I observe a lot of these doctors now, the new line is, I'm such an amazing, OBGYN or whatever hormone doctor because I listen to my patients. I give them the hormones that they need, right? Like there's this kind of like, I don't have a word for it, but you know what I mean? Like, oh, I'm such a good one, Meanwhile, the reality is, even we know HRT, BHRT, it doesn't work for every woman. So there's now what I'm seeing more and more of lately, women that have gone onto the hormones and they've kind of like gone through it for 3 or 6 months or 9 months because the doctor said you must stay on it, it's going to get better, and things haven't gotten better, and now they have new symptoms and they have 20-30 pounds more weight, and they're still being told, well, maybe you need a different kind and we need to change and whatever, instead of going like, have we even looked at their liver detox pathways, and have we looked a little bit deeper, have we looked upstream, downstream, what's happening? None of that is being discussed.
Well, and I think not only are they not looking at like liver pathways, they're not even asking their clients, are you having a daily bowel movement? What are you drinking during the day? Is it water or is it Coke, caffeine and alcohol? Are you on the caffeine and alcohol diet that I used to call the coffee and wine diet? The really simple questions that could be big needle movers. We don't even need a lot of complex testing to make a huge difference. And then, you can even look at basic foundational labs. Does this person have enough vitamin D? How are their liver enzymes? What does their lipid panel look like? What does their metabolic panel look like? Super basic labs. And this is not happening at all, because physicians are just stressed. And so they're like, okay, I hear you. So I think there's a couple different conversations going on when doctors say that, like, I will listen to you, I'll give you the hormones. So number one is women's pain and discomfort and anxiety and actual warning signs, the niggles, as you said, are gaslit and dismissed most of the time. And that's because we don't have an easy solution for that. If you're asking clinicians in 7 minutes or less to come up with this complete plan, they can't. So they're just like, you know what? You're fine. You're not going to die today. And so
Not
go
on my
home.
watch.
Yeah, exactly. So go home. And so step one really is listening. Okay. So then we get practitioners who are like, okay, I listened to you and I gave you a treatment to soothe your symptoms. Okay. I mean, we're moving in the right direction. But as you said, there's so much more to it. I mean, it's the same thing. Like what I'm sure we're going to find out, having worked in chronic illness for almost 25 years now, is okay. Like in endometriosis, what used to happen when women had severely painful periods is they would be put on hormonal birth control. And 30 to 35% of the time, that would quiet their symptoms. So they're like, good. And then it doesn't pop up again until they're trying to get pregnant and something else happens. They have to deal with that. So, or for many women, that didn't really fix it. So they spent 5 or 10 years going on different kinds of birth control or taking, more severe hormone suppression, like GnRH agonists. And then that doesn't work. So then they're on pain medication. Then they're on antidepressants. And so you get this multi-pharmacy challenge. And I think that's the exact same process until later now we see women in their 30s who went through all of this for 10 or 15 years. Now we have much better surgical techniques. We have an integrative approach, nutrition, lifestyle, physical therapy, mindfulness, fascial mobility, like all of the visceral mobilization, like lots and lots of better tools because the first ones failed. I think we're going to see the exact same thing in 10 to 15 years for perimenopause, menopause. All the women that are going online, filling out a questionnaire or seeing a doctor, and they're like in 7 minutes being like, oh, you're in perimenopause. Take this progesterone dose, take this estrogen transdermal dose. Okay, fine. For some women, they're going to feel a lot better right away. Then it's like, oh, problem solved. I don't have to take a look at anything else. I'll just keep eating exactly what I'm eating. Or you get, a large percentage where problem improved. Is there anything else? Nope. Go do your best. And then those for whom it's either harmful or it doesn't work, they're just left out to dry. Yeah. So, and then even the ones for whom it worked, if it was done in isolation, as we're saying, my guess is the problems are just being kicked down the road because you can't solve a metabolic issue only with estrogen. And that's often at the root of it. And, and also the neuroinflammatory issues, the immune issues. It's not just a one molecule solution. So I think you're exactly right. I think the problem is that it's such a low bar that if you get a clinician who just listens, like, there's a
you're
big,
a lifesaver. You're a lifesaver, and which is why when I get into these, discussions or groups or commenting somewhere, and I kind of say, well, HRT isn't the only solution, and oftentimes it just doesn't work. The slew of women that just kind of like jump on me and literally want to kill me because I'm taking away their right, to hormone replacement is quite fantastic to kind of observe, and there is no wanting to reason in terms of, well, hang on, like you said, how can one molecule resolve everything that's been going on in your body, when we know, like, ultimately, to me, it's like logic, right? Like, what is driving hormones? I mean, come on. We know that it's digestion, it's microbiome, it's the immune system, it's the upper endocrine system.
It's
It's
the
like, wow,
brain. Yeah.
it's everything. It's like so many
Yeah.
things are involved, and yet we are only looking at hormones. So that's it's, I'm glad we're having this conversation so that the listeners, because again, and it's something, that needs to be repeated for years and years and years, because many women still aren't going to want to hear this the first time around. And so, here we are having this discussion. And
Well, really quickly, I think it's important also to acknowledge that why we're kind of reflexively being like, don't tell us not to use this, right? In the same way that there's a conversation around being really careful about how we demonize birth control, because it should not, I don't think any of these tools, like on the flip side, from kind of an integrative perspective, we do not want to demonize any of these tools. They are neutral. They're just tools.
yeah,
And the problem is when they become demonized, they're not saviors and they're not demons. They're neutral tools. Because when they become demonized, then we do have the problem that we're staring down the barrel of the gun right now in the United States, where we lose access to them, and we need them.
yeah,
For many people, for millions of women, hormonal birth control is really valuable. I also think it's absolutely fine for people to utilize hormonal birth control for birth control if they want. Again, put it in context. Same thing with hormones. Same thing with tools for reproductive endocrinology. Women's healthcare is also under attack. So there's this challenge that we have to be really careful how we talk about these things, because there are so many low bars. Literally a clinician visit on average is 7 minutes. So just to get a clinician to listen to you is like step one. And the access to these really valuable but neutral tools, and not good for everyone, not terrible for everyone, and always needing to be put in context, we are also losing access to those things, which is a really big problem for women's health and women's, I would say, economic power, resilience. For some women in their 40s, 50s, and 60s to be able to maintain a business, a career, just a really vital life, hormone replacement therapy can be really valuable, medical hormone therapy. Same thing for a woman with endometriosis who is trying to, finish her graduate degree before she can have surgery and get access to the multidisciplinary suite of tools. Let's say she's in that 30% where this tool, this neutral tool, helps her get through that time period from a symptomatic perspective, or she simply wants to delay pregnancy. We have to be really careful about how we talk about these things from both sides of the coin.
for sure.
So anyway, that's what I wanted to add.
Absolutely. I do appreciate that angle. Let's talk a little bit about endometriosis, because I feel, first of all, because it's kind of your expertise, and because it is one of those subjects that still many people kind of like don't want to touch, don't want to address, because it feels so overwhelmingly complex. And I wanted to, again, for our listeners, sort of in closing, I want our listeners to walk away with the knowing that there is absolutely hope. And because the general story still is, once again, oh, there's nothing you can do about it.
Yeah. Yeah. I think when it comes to endometriosis, while there's still a lot of mystery surrounding this disease, Shannon Cohn, who's a filmmaker and film producer, has done a lot of really amazing work in partnership with other people, including Dr. Iris Orbuch, who's a wonderful integrative endometriosis surgeon, who has endometriosis herself, and so does her daughter, and they've been very public about it. They have helped secure quite a bit of new funding. And there is more and more research happening in the world of analysis of menstrual blood to help give us better diagnostic tools. So the challenge with endometriosis is it's hard to diagnose. Right now, it can only really truly be done surgically. There are some ways to diagnose it with imaging, but if it's not seen on imaging, it can't be ruled out. So you can diagnose it, you can rule it in with imaging, but you can't necessarily rule it out. So endometriosis is a chronic autoimmune inflammatory condition. Autoimmune, I say that with a pinch of salt because that's debated in the literature, but it's absolutely an immune system driven disease. It's also driven by probably, there's some new research out about a year ago talking about certain gut microbiome bacteria being associated with endometriosis. We get into a little bit of a chicken or egg conversation on that. But endometriosis is not really just a pure, one of the things that's seen in the integrative spaces is that it's just an issue of estrogen dominance. That's not true. Endometriosis lesions do produce their own hormones in many cases, often local estrogen, and they can be influenced by hormones. But really, we have to look at it, and this goes back to your conversation about hormones not being in isolation. When digestion is more optimized, when the gut microbiome is more optimized, when the neuroimmune system is more optimized, endometriosis symptoms begin to reduce significantly. Now, not everyone needs endometriosis excision surgery, but for many people, it can be really valuable because the lesions themselves kind of hijack and disrupt the immune system. And as I mentioned, produce their own hormones. So surgically removing these lesions can be very, very helpful in many cases. And often, so by definition, endometriosis lesions grow outside of the uterus. So hysterectomy is not a solution for endometriosis. It has to be skilled excision surgery. And often these lesions are also growing on the bowel or bladder. In fact, they've been found all over the body, the diaphragm, the lung, the nose, the knee, joints. So endometriosis is a systemic disease. It's not just a disease of reproductive organs. And so when these lesions particularly grow on and around the bowel and lead to inflammation and adhesions in the bowel, even post-surgically, there's often little stickiness areas on or around the colon or the small and large intestine. And so we often have to really optimize digestion. And we utilize things like motility types of therapies. Even still, sometimes because there can be these little sticky spots, we have to use like antimicrobial herb strategies in a pulsed manner. So sometimes this disease process, depending on how much damage it inflicts structurally on some of the organs, has to be more managed over time. But we have a lot of tools for that. We can use antimicrobial herbs. We can use specific probiotics. We can use enzymes, can be really, really helpful to break down some of these adhesions and lower the inflammation. So I think that's really the message of hope, that yes, this disease is a bit complex, that often surgery is a really important part of the conversation, at least for now, as we're developing better and better tools. There's a time and a place for both hormonal birth control and medical hormone therapies. But at the root, we've got to keep healing the gut microbiome, the digestive system, the immune system. And the great news is we have a lot of tools for that.
Absolutely.
And so, many of my patients with endometriosis have significant improvement within 1 to 3 years post-surgery. And some of them choose never to have surgery and do very well. Many of them, do just fine having babies. There's an infertility component to this too, but we, all the things that help optimize the disease or, reduce the disease and optimize the system also help with fertility and and I can't think of a single one of my clients who wasn't able to later get pregnant depending on their age. If we don't really know someone has endometriosis until their early 40s, it becomes a little more difficult. But anyone I've worked with in their 20s or 30s who desired to get pregnant, I can't think of an example where they haven't been able to.
That's wonderful news. Lots of good news for endometriosis sufferers. And last question, just because I love peptides. So, do you
Yeah.
work with the peptides or rather, what is your experience with peptides in endometriosis?
So, mostly in my practice, I've used the peptide bioregulators because they are more accessible. We are starting to integrate GLP-1 peptides now that I have a nurse practitioner on the team. We'll be relaunching our programs for that in later this fall. But so peptide bioregulators I find most valuable for two circumstances. One is for people that because of, for example, a major stressor or something like that, essentially have moved into a premature menopause in their late 30s or early 40s.
Yeah.
Within just a few months of, being on the pineal, vascular, and ovarian peptides, very often their cycles can be optimized. And I think even doing these for women with perimenopause and menopause, even if they have to be on low dose hormonal therapy, using peptide bioregulators really does enhance just the resilience of the neuroendocrine system. So
Absolutely. Yeah.
that's been really effective. And then the second thing is many of my patients with endometriosis, there is some research showing that people with endometriosis have lower levels of the GLP-1 hormone, if you will. It's not really a hormone,
Yeah.
it's a peptide,
Yeah.
but it's like insulin. It's a
Yeah.
peptide that is actually usually developed by the body.
Mhm.
And we have used some probiotics that help support the body's own production of GLP-1, which I am finding effective for metabolic improvement. And then for more kind of, I don't know, I would say like obvious improvements, using low dosed compounded GLP-1s and sometimes normal dose, depending on the person's degree of metabolic dysregulation.
Mhm.
The symptoms of endometriosis can be dramatically and quickly affected. And of course, in this environment of really high levels of post-viral syndromes and, post-COVID issues, a lot of my clients with endometriosis also have long COVID at some level. And so another really valuable tool are the GLP-1 peptides for reducing inflammation, improving metabolic health, and all of those, both endometriosis and chronic viruses like COVID or EBV can kind of knock those systems out of whack so that
Yeah.
the things that normally would have just helped them without these medications or peptides, the weight training, the changing of their diet, when they're not effective, layering on that other tool can really move the needle quickly.
Yes, absolutely. I'm also a great fan. I mean, besides, of course, the bioregulators, which in many cases I'm surprised at, like you said, how quickly they regulate women's hormones, and no other intervention is needed. And
Mhm.
that definitely has been my personal experience as well. But besides the GLP-1s, I've also found working with BPC 157 and low dose thymosin alpha 1. And I think this is where, once again, dosage makes all the difference. And I think out there's so many disparaging opinions in terms of dosages. Like sometimes I see dosages recommended, especially for things like thymosin alpha 1, that I would never suggest someone start with, especially when they have autoimmune conditions, right? Or immune issues anyway. You don't want to send them into an immune storm either. And oftentimes just the small doses. And so, for the listeners, again, I want them to walk away from this conversation knowing, like you said, there are so many tools and
Yeah.
so many options, which I think a lot of sort of mainstream doctors simply don't have the knowledge yet to
Yeah.
correctly apply. And especially with peptides, what I've noticed is that sort of the traditionally trained doctors, they all tend to completely overdose those that are using peptides because they're being instructed by the pharmaceutical industry instead of being, getting their knowledge from sort of the people that have maybe been working with peptides for a long time and therefore have the experience. So it's, again,
Yeah.
to watch out for.
Well, and that's the other thing too, is if you don't do all of the things to kind of, using nutrition, lifestyle medicine, and exercise to get those systems in the best place we can, given the person's circumstance, and not just exercise, but also recovery, sleep, stress management, things like that, then the person doesn't need as high of a dose, which is really
Yeah.
important. But also what you said about kind of immune activation is also really important. One of the reasons I don't use a lot of BPP 157 is that many of my clients with endometriosis or with post-viral syndromes have mast cell activation syndrome. And so until we get that under control, that's another sort of semi contraindication for estrogen replacement because estrogen is a mast cell degranulizer. So with all of these tools, when people are immune hyperactive, and usually it's because the immune system is trying to kind of right itself, but either there's viral persistence or endometriosis can trigger histamine issues. We have to be more careful with some of these stronger tools. So I totally agree with you that using them can be really helpful, but always starting with the lowest possible dose just to see how the system tolerates that, because sometimes people aren't ready for it. It might not mean that they're forever not ready for it, but it might mean that they're not ready for it yet.
Absolutely. And that's where, again, the groundwork, the step by step, right? Instead of like, yay, let's just, move into, I want to do peptides. Well, hang on.
Right.
And there's all this other work that we first need to do. And sometimes, like you said, it takes 6 months or a year because
Yeah.
the body, we need to listen to the body instead of, I want whatever it is we think we want because it's going to be good for us and all of that. Well, Jessica, I am so delighted that we have had this conversation, and I think these are the really important conversations to have. And I just love the work that you do, and just the way you do it, and all the components that you bring to the table, I think are just so invaluable. And yeah, thank you for joining us here. Thank you for the listeners. And, those of you listening, spread the good news that there are a lot of answers. Like, we don't have to suffer, right? I mean, that's really the biggest, it's like, we don't have to suffer, but at the same time, it takes strategy. And when we do it right, when we get the support that is needed, we can actually really thrive in a body well beyond, the years that we're told that we're going to be able to thrive. So thank you,
Yes.
Jessica, for your work and your wisdom.
Thank you so much for having me.
Thank you.